everyone. We're live at TEDxBeaconStreet. We are honored to have Dr. Sharon Levy from Boston Children's Hospital, who just gave a talk on addiction is treatable. Thank you, Dr. Levy.
Thank you.
We're interested in knowing that what made you passionate about the opioid addiction in your initial practice experience?
So, I didn't grow up dreaming of becoming an addiction medicine specialist.
Right.
Actually, what happened was really quite fortuitous. Right when I was finishing my training, the hospital received a philanthropic grant that was to open a substance use disorders treatment program for adolescents. That was a very, very unusual thing at the time, because this was back in 2000.
I see.
So really before the opioid epidemic had
Right.
peaked quite the way it has. And somebody whose child had struggled thought it would be really great for the hospital to have a program like that. And I was coming out of training, and the division chief at the time said, "Would you like to do this as a job, as a faculty position?" And like I said, it's not something that had really entered my mind. My training was in developmental behavioral pediatrics. And so I actually said to him, sounds interesting, but I really don't know that much about substance use disorders. And he looked at me and he said, "Well, nobody else does either, so
I see.
might as well be you."
Right.
So we went ahead and we opened the program, and we really very quickly learned that there were a lot of kids who needed the service,
Right,
and
yeah.
we figured out how to do it. In 2002, this new medication called buprenorphine that I mentioned without its name in the talk
Right.
became available, and shortly thereafter I got licensed to prescribe it.
I see.
And in 2004, we started treating teenagers with opioid addiction with medication,
I
and
see.
so we were probably among the first people doing that. And
Right.
what happened was we saw these remarkable transformations. These kids would come in really struggling, and it was
Right.
obvious, from the moment they walked in, just like the
Right.
kids that I described.
Yeah.
Many of them had lost so much and
Right.
were struggling and were trying to keep everything a secret. And then we'd get
Right.
them into treatment, and we'd start them on medication, and we'd start them working with a counselor, and we saw them sometimes in the course of just weeks
Yeah.
turn into new people.
I see.
And so we knew that this was the right thing to do, to go out and
Right.
treat these kids.
Right.
And so that's
Right.
what's made me passionate about it. But as I said in the talk, a lot of kids have opioid addiction. Only few kids can get to Boston Children's Hospital on a
Right.
regular basis. And
Right.
so we needed to figure out a way that we could bring the treatment out to where kids are.
Yeah.
And that's when we partnered with this network and said, well, let's do it in primary care. And that's been an amazing success so far.
I see. Yeah, it's really wonderful to bring these young lives back to track, right? Yeah.
It's amazing, and I'll tell you that every year we get anywhere between 5 and 10 letters of patients that we treated years and years ago.
I see.
Just saying, "Hey, I want you to know I'm doing great. Thank you for providing treatment." And the amazing thing that I really want to emphasize here is, I was listening to the talks before mine, and they were all about these amazing ideas, and some of them were really ingenious. And actually, what I do is I'm really just using the medication to do what it's designed to do. In fact, this buprenorphine medication was really designed to be used in primary care.
I see.
So it's not a stroke of brilliance on my part that we might be using it in primary care. It seems like it because the uptake has really been so slow,
Right.
and it's been really hard to get doctors to do and patients to come in and ask for, and and it's not. It was really not a major innovation to use this medication. It was just a lot of cheerleading to get people to do it.
I think Dr. Levy must be very humble, but I think it's all about the action, the execution of the ideas, right? So you made it into action, and then you really saved these lives. That's what shines through. Yeah.
And we convinced other people that maybe they could do it too.
Right. And I heard in your talk you mentioned there's going to be a new center opening up in a few months. Is that correct?
Actually, we're going to be opening it's a primary care practice. It's out in Bridgewater, Massachusetts, and we're going to put the same program that we put in our first in Wareham Pediatrics. We're going to put a licensed clinical social worker. We're going to train the pediatricians how to prescribe these medications, and we're going to provide them backup support, and they are excited and really ready to go on this. So
I see.
I'm hoping that we have the kind of success that we had in our
I
first
see.
program. I think we
see.
will.
Okay, the actions are really rolling.
Yes, they are.
Awesome. So thank you so much one more time, Dr. Levy, and we're happy to have Dr. Levy taking the time after the TEDx talk. The talk title is Addiction is Treatable. Please check out TEDxBeaconStreet for more information. Thank you.
Thank you.